So, as you can see on the screen, there are many vacancies in adult care across the UK with roles available for experienced professionals and entry-level positions like care assistants and support worker. The demand for care workers is particularly high in residential homes because of our ageing population, but also the aim of any authority or social services is to keep clients and patients in their own home for as long as possible. So the aim is to provide them with more support in their own homes for longer before the need for them to enter a residential home or indeed enter secondary care. So more often we're seeing now people remaining in their own homes to their end of life, even if they need palliative care or indeed a live-in care assistant. This is becoming more and more evident within the community sector. So again, you'll probably see the demand for community care workers growing exponentially higher in the next few years, and the demand for care home workers dropping off a little bit as more people are able to remain in their own homes. So again, this relates to job security in the adult care sector. Because of the demand, if you have the right qualifications and you gain experience, you will be in demand for various roles. So your chances of applying for various roles and gaining various roles and climbing the ladder, so to speak, will rise because the demand is so high. Could I have the next slide, please, Noah? So here you've got some examples of salaries. So it gives you some idea of the range of salaries. So it does depend on the context of your role. So private care home salaries may differ from NHS roles, not always. For example, in nursing, they don't. And in a lot of care worker roles, they don't. They're fairly stable in that regard. And salaries will depend upon qualifications and experience. So the more experience you've got and the more qualified you are, then the higher the salary you can actually demand. And usually within a role, there will be a salary scale. So if you're starting out as a care worker and you've had no experience and you've got an entry-level qualification, you will start on the basic salary. But as you progress and you gain more experience and you perhaps do a lot of more training, another level certificate, then your salary may increase. And that will be outlined by your employer at interview. So again, as I've said, the job security is quite stable because of the high demand. Could I have the next slide, please, Noah? So we've spoken about various qualifications aligned with sector roles. So you may decide to apply for a care worker role without any or minimal qualifications or experience, and this is called direct entry. And you might study for higher qualifications whilst you're working in that role, or your employer may support your studies by contributing to course fees and or allowing you study time. This is dependent upon each employer's policy and requirements. So therefore, if you apply for a job, which is direct entry, and have the minimum qualifications with no experience in care, it's a good idea to ask the prospective employer what provisions they make for CPD or in-service training. Now, when you look at an advertisement for a role, you're looking on a recruitment site online and you see a role, and look at the person's specification, and if you see the word preferred, so it might say preferred experience, that means you don't have to have the experience. They would prefer you do, but it doesn't preclude you from applying for the job. Now, if you apply for the job and you've never worked in a care context before, but you may have helped look after an elderly relative, for example. You may have had a volunteer position, for example. So that will go in your favour when you apply for a job. So in your mind, before you apply for a role, think about instances where you've you've actually helped care for somebody. It might even be on a short-term basis. For example, you know, your mum or your dad might have had surgery and they've come home and they need some help with their care. They need help getting dressed, etc. You may have done this for a friend. That's all vital experience, and that can go down on your CV. So think about this before you apply for a role at a direct entry level. So there's excellent sites for exploring pathways. Again, NHS careers, gov.uk for apprenticeships, but also see if you can volunteer. Volunteering is an excellent way to gain experience, and what this will also give you is a reference for you entering into a role. So you've had no formal experience, you might not even have any formal qualifications, but you're thinking about studying or you're just about to study, but you've volunteered. It could even be online. If you think about, for example, Age UK, Mind, all these charities, they all have volunteering positions online. You don't necessarily need to volunteer face to face, but you might prefer this because it gives you some hands-on experience. And for example, if you approach a care home where you live and you just want to see whether it's actually for you, approach them and say, can you come in, you know, once a month, once every 2 weeks? Can you help with their activities? Usually care homes once a week might have someone come in and do a sing-along with the residents, or for example, they might help them as we're running up to Christmas, make Christmas cards, things like that. So it's a good opportunity for you to say, could I come in and help for a couple of hours? And that will give you good experience, but also the care home will be able to give you a reference. So think about these things as you're starting to enter into a new role. Could I have the next slide, Noah, please? So we're looking at building your profile, and we've already discussed how you can do this through volunteering, gaining experience, gaining qualifications. So be prepared, get your qualifications, write a good CV, look online for CV writing sites to help you. Within the CV, highlight your skills, your strengths, your experience. If you haven't worked before in the care sector, highlight your informal experience. As I've said before, anything you can think of that can go down on your CV. So the thing is about CVs, you have one that is your basic CV. It'll have all your qualifications and your experience, etc. in it. But for every role you apply for, check that it's relevant, because you may need to tweak it a little bit, because you may need to add something in, you may need to take something out. So always make your CV bespoke to the role and organisation you're applying to. It's worth remembering that. So for example, if you're applying for a role as a care assistant within a residential care setting, but not had any formal experience, but you've achieved your level 2 certificate in adult care, you'll want to highlight this formal qualification, and then maybe explain that you've had experience in informally caring for somebody at home or a friend, or you've helped out here, you've helped out in a care home, etc. Highlight your interpersonal skills. Don't be afraid to say something like, I have excellent communication skills, I am empathetic and caring. Now remember, at interview, you might be asked for specific examples. Now, interviews follow a standard pattern. They're called cognitive interviews, and employers will always say things like, tell me about a time when you assisted an elderly relative, client, patient who had mobility problems. Okay, they'll always ask you something practical. Tell me about a time where you had safeguarding concerns about an elderly client. What did you do? How did you report it? What was the outcome? Can you explain how you would deal with a client you visited in their home who has unexplained bruising on their arms and legs? So everything that in your interview will be tailored to your CV, so they will know what your experience is, and they will tailor their questions, and you will always be asked for examples. Give me an example of A, B, C. What did you do? What was the outcome? Who did you report to? So be prepared for this. Practice this. That's why you need to tweak your CV to make sure it's relevant for the role that you're applying for. Finally, obtain a list of people who'd be prepared to provide you with a reference. Volunteer placements are excellent avenues for this. Previous employers, personal character references, schools and colleges can usually only provide you with dates of study, but these are useful too. So all these things build your profile and keep your profile up to date as you complete a course. Remember to put it on your CV. As you might complete a bit of CPD training, put it on your CV. So it's important to keep it up to date. Could I have the next slide, please, Noah? So you're thinking about progressing. You've worked in a minor role, you've advanced, and now you want to progress. So think about your aims and objectives. So return to your plan. Look at what your aims are. How have you done? What have you achieved? For example, you might be thinking about working towards a senior care worker role. So you may need to study a high level course such as the SLC level diploma in health and social care or level 5 extended diploma in health and social care. Find out exactly what your employing organisation requires for the role you want, or investigate generally. So when you see a role advertised, for example, an online recruitment site, it's perfectly reasonable for you to contact the organisation and ask what formal qualifications are needed for this role, if they're not specified within the job specification or advertisement. Normally in an advert, you will see at the bottom, it will say person specification, right at the bottom, it will say, if you wish for more information on this role, please contact. And it'll either be an email address or a phone number. And employers quite like you to investigate, if that's available, to investigate and ring up and say, I'm just checking, I've got this, I want to apply for this role, I've got these qualifications, I've got this experience. Is there anything else that you require? And ask them questions. And again, that will be noted so that if you're shortlisted for interview, it will be noted that you made inquiries. So if you want to go on to become a registered care manager, you will definitely need a diploma in leadership and management for adult care. For example, the level 5 diploma in leadership managing adult care services from SLC. So again, there's lots of courses that SLC provide if you want to move up in adult care, but you need to understand which direction you want to go in and exactly what the organisation you are working for or want to work for require before you move up. Could I have the next slide, please, Noah? Right, so we've looked quite a lot at various training pathways and roles, including specialisms. But if you decide to switch role or specialise, you'll need to make sure you have the correct formal qualifications for the role. So again, find out what the requirements are and plan a study or training pathway for yourself that will ensure you have the best chance of attaining your goals. If you're unsure at all of which courses or pathways to follow, seek advice from your student support team once you have all the information you need. For example, if you're working in a residential care home for people with dementia, but want to be able to assess care workers practically or theoretically, you'll need to have a qualification that's a minimum of one level above that which you are assessing and a relevant qualification in assessing. For example, if you're assessing someone at level 3, then you need to have a minimum level 4 qualification in that area you're assessing. For transition into nursing, for example, you need to explore universities to find out if your prior learning and current qualifications will gain you entry into a nursing degree, as said before. So again, if you're thinking of specialising or switching, talk to a study advisor. You might be in a role and you say, I'm looking at this role, I want to specialise in this, I want to look at end-of-life care, thinking about undertaking your palliative care course. I've contacted my my human resource manager, and they've advised me to look at these sort of courses. How can I progress through my pathway? We've already spoken about transition into nursing in some detail, and that really is sort of a whole different ball game. And if you look on the Nursing and Midwifery Council's site or the NHS career site, again for nursing, they have an awful lot of information. And also you could look on the UCAS site, which will give you all the universities in your area, wherever you are, that offer nursing degrees and offer the also offer apprenticeships into nursing. So explore, find out what you want to do, look at your action plan. What have you achieved? Where do you want to go? How do you want to do it?